Hi everybody, my name is Shanelle Dyke with Quality Reporting Services, and today I'm going to provide you with an overview of the Emergency Department Transfer Communication Project. So I will start with an introduction into the ED Transfer Communication Project. I will give you a bit of rationale and background as to how it came about. I will give you a project summary overview to help you better understand the connection to the Medicare Beneficiary Quality Improvement Project, also referred to as MBQIP. I'll go over the ED Transfer Communication measures, and then finally dive into the ED Transfer Communication training. I'll review the Data Collection Specifications Manual. I will provide some navigation and use of the ED Transfer Data Collection tool itself, as far as data entry and report generation and so on. And then finally, I'll wrap up with a brief overview of the ED Transfer Data Collection Tool Manual. So to start with the introduction, as of April 2016, there are just over 1,300 critical access hospitals in the United States, which is a special designation for small rural hospitals with a limited scope of services, 25 or fewer hospital beds, and geographically isolated, serving as an acute care safety net for rural residents. While any single critical access hospital does not serve a large number of patients on any given day, in 2009, CAHs accounted for over 417,000 Medicare inpatient stays, not including swing bed, and over 11 million outpatient claims, reflecting an important component of care delivery in this country. CAHs meet the basic care needs for the rural communities and service areas, for example, pneumonia and heart failure care. They also provide crucial stabilize and transfer functions when patients with more complex needs and conditions such as acute myocardial infarction, heart attack, stroke, or trauma arrive in their emergency rooms. For example, when a patient arrives at a CAH emergency department needing care and services, especially time-sensitive care, that the critical access hospital does not provide, the CAH's ability to assess, decide to transfer, and get the patient out the door with the necessary and appropriate information can be life or death. Data indicating how well a CAH serves this important stabilize and transfer role was not currently widely available. Nationally, all large acute care PPS hospitals are required to publicly report a set of core measures indicating their performance in providing quality of care. Many of the publicly reported measures are not relevant to the low volume of services provided by a CAH. Low volumes result in unreliable data, and some measures are for services not being provided at a critical access hospital. While emergency care is important in all hospitals, the emergency department is particularly important in rural hospitals where the distance to urban tertiary care centers makes the effective triage, stabilize, and transfer of patients with the necessary and appropriate information of life or death important. ED transfer communication measures allow the acute care safety net facilities to show how well they carry out their important stabilize and transfer role for rural residents within their communities. In 2003, CMS selected Stratus Health, the Medicare QIO for Minnesota, to lead a special study to identify and field test rural relevant hospital measures. Stratus Health led the study called Refining and Field Testing a Relevant Set of Quality Measures for Rural Hospitals, in partnership with the University of Minnesota Rural Health Research Center and Health Insight, the QIO for Utah and Nevada. In the study, staff from 22 hospitals in 3 states, Minnesota, Utah, and Nevada, were trained by Stratus and its partners to collect a variety of inpatient, outpatient, and administrative measures of relevance to rural frontier hospitals, including for the first time the Emergency Department Transfer Communication Tool, which was developed for the study using the continuity of care record. As part of the study, a national technical expert panel provided input and insight on both the design of the study and its findings. In the study's final report in 2005, it stated, the transfer communication measures are very promising. Pilot hospitals found it useful and relevant. Several hospitals have been inspired by the measurement process to improve their systems of transfer communication. In this study, the measures only address transfers from the referring hospital's ED. The measures, combination of administrative information, patient identification, and patient care information can also be applied to any transfer of care of admitted patients. Perhaps with minor modifications, the transfer communication measures could also be relevant to transfers to nursing homes and referrals to home health agencies. Information on all 16 components of the measures are useful for hospital quality improvement. Back in 2013 and 2014, after the end of that original pilot test, well, that was actually earlier, back in like 2005, but in 2007, the University of Minnesota and Stratus Health successfully put the ED transfer communication measures through the NQF, National Quality Forum, endorsement process, and that was actually completed. And then after that, they decided to spread it a little bit further, and CMS came up with a special innovation project, which was rolled out to 8 states, that being Iowa, Maine, Missouri, Nebraska, Oklahoma, West Virginia, Wisconsin, and Wyoming. Some of you Wyoming critical access hospitals might remember that back in 2013, I reached out to each one of you, and pretty much the majority participated in that pilot project. As a result of the ending of that pilot project in 2014, the Medicare Beneficiary Quality Improvement Project, being done by Flex, adopted it. And so now it's being used in every single state in almost all critical access hospitals as part of their ED transfer communication data collection and reporting as a requirement of MBQIP Flex funding. So just real quickly, some of the results from that initial special innovation project: the participating critical access hospitals increased their percentage of medical records, meaning all of the ED transfer communication data elements, over the course of the project, from the original 28% to almost over 44%, which gave us a relative improvement rate of 56%. The hospitals used the results to develop and implement improvements to focus on better documentation and communication processes within their facility. So just on this slide, there is a link that provides the final summary report of the Special Innovation Project if you're interested in learning a little bit more about that. So real quickly, the project summary. So the Critical Access Hospital Emergency Department Transfer Communication Project is intended to build on Flex capacity to support and improve the care delivered by critical access hospitals, focusing on transfer communication from the CAH's emergency department. As I mentioned, all these measures have been endorsed by the National Quality Forum, and all of the ED transfer measures are relevant for critical access hospitals, and as I mentioned, are included in MBQIP. So right here on the screen is a snapshot of the ED transfer communication measures. The ED transfer communication measures required data elements that have been endorsed consist of a series of 27 submeasures reflecting 7 domains. So the 7 domains are those in the black fields, and then for the 27 submeasures, those are in the white fields. Relevant measures reflect decision-making and protocol availability and their use in decisions about where to treat a patient, processes for stabilizing and transporting patients, and care integration with referral hospitals and other care delivery systems. Hospitals' results can be calculated using different methods. You can calculate the 7 categories or domains using an all or none approach, which is simpler to report and provide a single score. Then you can calculate a score on all the 27 subcategories with the credit given when earned approach. This approach helps define opportunities for improvement and inform strategies. Each of the 7 categories or domains is calculated using an all or none approach. The data elements are identified for each measure. If the data element is not appropriate for the patient, items scored as NA, not applicable, are counted in the measure as a positive or yes response, and the patient will meet the measure criteria. The patient will either need to meet the criteria for all the data elements or have an NA to pass the measure. So now I'm going to bring up my desktop. and I'm going to dive into the ED Transfer data collection tool itself. When you download the ED Transfer data collection tool, it is an Excel-based database, and when you open it up, this is the first screen you will see. And once I scroll down here, to get started, you will need to enter in your CMS certification number of your critical access hospital. For Wyoming Critical Access Hospital, your CCN starts with a 5313, and then the last 2 digits are specific to your facility. For the purpose of this demonstration, I have just entered in a random number. So to begin entry, I will click here to start data collection. It will bring me to a new window, which will automatically populate the hospital certification number. You will need to put in your state. Please note that to enter the state, you just do the abbreviation. We will enter in a patient name. I'm going to do Mickey Mouse. You will need to enter the patient's medical record number. I'm just going to do a random one. I will select the discharge disposition, and please note in this drop-down list you will see that there are only 6 options available. These are the only options that are eligible for abstraction. So if you pull a patient to start entering it and it doesn't meet one of these discharge dispositions, it's not included. So I'm just going to randomly select one and then enter the date of the patient encounter. Please note the format. It's month, month, day, day, and then year, 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 year. So for example, I'm going to do, let's do a 3rd quarter case. We'll do 07/01/2016. The name of the person doing the data collection, it's populated already to myself, but if it's new and it's an empty database, you'll just need to type in your name here. The year of the data collection that we're focusing on right now is 2016. It automatically populates that. And then I'm simply going to say add new record. This is a new record, add to the database. Yes. And then it'll bring up the data entry form. So here I'm just going to go through and answer yes or no or NA for this Mickey Mouse patient. And please note, like at any time next to any of these questions, if you're wondering what exactly it's asking you, after every question there is a blue link that says data specifications. And we're actually going to dive into that in more detail in a little bit, but I just want to show you, for example, what it'll do. So for respiratory rate, if I'm kind of wondering, what exactly are they looking for? I'll click on data specifications. It will bring up a new window, and here it will give me the definitions for that data element, the allowable values, what it means to answer yes or no, and then it'll also give me some information on where I might look to find that information, such as the transfer summary, nursing notes, the ED record, and then it'll also give you some information as to what's included and what's excluded. It actually will do this for every single one of the elements, but like I said, if you click on that link, it'll only take you to the relevant information for that question. And then to get back to the data entry form, I simply go up to the top and click on the link, data entry form. It'll bring me back to my abstraction, and then I will just scroll back down and finish where I left off. We're just going to select yes for all of these. And please note, once I get down to the bottom, you can't just exit during the middle of an abstraction. It's not similar to the CART application. You have to actually complete this entire abstraction before you can exit out of it. If you do not, watch. I'll leave this last question blank and I'll hit Save Record. And it'll give me an error message saying, please select an option for test procedure results. So if during the abstraction I miss any of these questions by mistake, it will let you know when you go to save the record that you missed answering one of them. So I'll just go ahead and click OK, and then I will finish answering that question. I will hit Save Record. It may take just a quick little minute. It runs on macros, so it can take a little bit of time. And so right here it'll say it's been saved, so I'll just hit OK. And it'll bring me to a list of all of the records that I have put, or cases, or abstractions, however you want to refer to them. that I've entered to date. You'll notice I have some blanks here. I was actually, I deleted some of the cases that I had already had entered. But anyways, so you'll see that, oh, my bad. I have entered just a few cases to date. I think I have a total of 5 in there. You'll see right now, here's the most recent one that I put in. So for example, if I want to remove a record, let's say the one I just entered, I can just simply be in any one of these fields here, and I can go up and hit delete record. It'll say, are you sure? Yes. And you will see now that it's gone. And at any time if I want to edit a record, same thing. If I just click in any one of these fields here for this record, I can click open record, and I can edit it. And then any edits I make, just be sure to hit save. It'll say record's been saved. You click OK, and then it brings you back to the list of patient medical records I've entered to date. If I want to add a new record, I can click Add New Record, and it'll bring me back to this screen where I can start entering a new record. If I want to view all the records, I can click View All Records. It'll bring me back to the listing. If I want to run reports, I can just simply click. You can do that from any screen. So for example, if I want to go back to the main page, here on this main page, I can click Reports. If I get to this screen, I can click Reports. At pretty much any screen will have certain radio buttons that allow you to navigate within the data collection tool. So I'm just going to click on Reports to show you at the end of every quarter, once you're done entering that quarter's worth of data, you will click on Reports. It will generate a report, and that report is what you need to email to myself and Kyle Cameron, and then we will get it submitted Kyle will get it submitted and off to the Fed. We use those reports to help us in identifying quality improvement activities for the future, to help improve any particular ED transfer measure, to help us create graphs to share with you facilities to show you trends over time, how we're having an impact on the measures with our quality improvement activities, and so forth. So this might take a minute because, like I said, it is built on macros. But as you can see now, the ED transfer communication report is up. And I only had third quarter cases entered, so you'll see all these other quarters are showing up as NA because I didn't have any cases in there. You'll see for third quarter it's showing my 4 records, and it's giving me a % across the board. And you can see my ED transfer 1, I actually only fared at 75% across each individual data element, but then as a whole I only was at 50. That's where that all or nothing comes into play. So 3 of the records I had the facility-to-facility communication, and on 3 different records I had the physician-to-physician communication. So overall, only 2 of my 4 charts met all of the healthcare facility to healthcare facility communication and the physician-to-physician communication. So if you look at this, while it's showing all my other ED transfer measures and domains are at 100%, look here down at the bottom. Overall, for the ED transfer measures, I'm only at 50%. So while I did great across all of the measures, except for just the one area up here, the ED transfer administrative communication domain, it's bringing down my overall results. So for this quarter, I'm only getting 50%. So couple tricks I want to show you real fast. Like, you can print this report, which will simply, and I'm worried about it freezing because, like I said, it's built on macros in Visual Basic Editor, so I don't want it to freeze during this demonstration. But if you click Print Report, it should print it to a separate document somewhere on your computer. It will bring up a screen, and you can choose where you want to save it. However, some people run into issues with this section of the tool. It could be due to the version of Excel that you're running. It could be due to the firewall on your computer and disabling pop-ups and all of that stuff from unknown applications. So a great workaround is simply, once on this screen, go to File, click on Print, and then go to, most of you should have an option to print a document to a PDF document, and then simply you would just select Print, and it'll say, hey, where do you want to print this PDF document to on your computer? I will just say desktop, and I'm going to do sample EDC report. Of course, I didn't know how to spell report. My fingers didn't want to work. So anyways, it did that. So I'm going to actually minimize this tool, and I have some other stuff up for you, and we'll see. Sorry, my desktop is a little cluttered right now. Where did it go? Oh, here we go, sample EDC report. And you can see I didn't spell report correctly. And here it is. It just printed it to a one-page PDF document. And again, this is the report that you will email to myself and Kyle Cameron. And that's it. That's all there is to it. So what I'm going to do now is bring up the data specifications manual. And this manual is, again, available on the web. But if you are new to ED Transfer and need help getting started, please contact me. My information will be on the last slide. Excuse me. And I can help you download the tool. I can help you get all set up. I can send you the transfer communication manual and any resources that will be helpful for you when starting this project. Anyways, just to show you how the manual is laid out, it's kind of similar and easier to follow than the inpatient or outpatient data specification manuals from CMS. But as with any, it starts with a table of contents to show breakdown. And then once you actually dive into the tool, it'll talk about population and sampling. So for example, if you're doing a quarterly sample, if during a given quarter, if you have less than 45 cases, you do 100%. If you have 45 or more cases, you would just simply do 45. And then monthly is similar. Again, if you have less than 15 each month, you would do 100%. If you have greater than 15, you would only abstract 15 for that month. But diving into the manual, it tells you how everything is calculated, which I already touched on, and then it starts with each domain. So, for example, the first domain being ED Transfer Domain 1, it consists of the data elements healthcare facility to healthcare facility communication and physician to physician communication. So these next few pages are just on the domain and the data elements that are associated with that domain. Similar to the slide I showed you where it had the 7 domains and then the 27 data elements or subdomains or subcategories. But to dive further into the actual measures and data elements, we'll scroll down a little bit more so we're still at the domain. Here we go, data elements and measures. So for the healthcare facility, the healthcare facility communication measure or data element, here is everything on it. It talks about what the question is in particular that they're asking, how you can answer yes or no and what it means, some notes for abstraction, and then suggested data sources on where you can find that information, and then what's included and excluded. And this whole manual has everything for every single data element. So here you see the physician-to-physician communication. I'm just going to jump way ahead and see, you'll see here's patient gender, here's oxygen, here's temperature, and so on and so forth. So that's the manual. And again, smaller portions of this, as I showed you on the actual ED Transfer data collection tool, the Excel portion, you can click on that link at the end of each question and it'll bring up a section that actually provides you all of this information. So I'm going to skip over now to the ED Transfer data collection tool user guide. And all this is a step-by-step screenshot instructions on how to use the tool. It's pretty much just a screenshot guide of what I just provided you a demo on. So for example, it gives you an introduction, some background, and again, the table of contents, the measures. And then one thing that I really want to point out to those of you who are new, this page right here. getting started. This is something I can walk you through, but if you're going to do it on your own, please pay attention to the instructions, and this is why. When you go out to this link to download the tool, you have to follow these instructions to a T. When you open up the zip file it will download, it is very, very important you do not edit any of the file names in any way. Whatever the defaults are, you leave alone. So for example, you can barely see right here on the screen, but it's like a long, long name of Stratus Health ED Transfer Data Collection Tool 2016 or 2013 or whatever version you're going to be downloading and using. If you at any way change the file names or the name of the tool or whatnot, the Visual Basic Editor macros that are built in will not function properly. So when you go to print a report, the report's not going to print because it's trying to print a report based on what has been programmed in, and that would be the default file names. So just moving past that, it talks about if you're using certain versions of Excel, what to do. Like this one right here, for example, has to do with enabling the macros on your computer within the Excel program. Otherwise, again, you'll run into problems with entry and running your report. Then finally, once you do all these, it jumps into the data collection and navigation of the tool, which is exactly what the demonstration I provided you with earlier. But this is a great guide that you can just utilize to help you navigate from within the tool itself. And that is pretty much it in a nutshell. So now I'm going to jump back to the recording. Sorry, not the recording, the PowerPoint. And I'm going to skip the next couple of slides because it was just talking about the demo and reviewing the manual and the tool. So picking up here real fast, like on the slides, we only have a couple more and then we'll wrap up. Why is this initiative important to critical access hospitals? Well, number one, it is part of the MBQIP and it is tied, it's a requirement and is tied to flex funding. But not only with funding set aside, it provides critical access hospitals with the opportunity to collect, analyze, and benchmark your transfer of care and the communication that you're providing in your ER. The measures were developed specifically for critical access hospitals and have been widely tested. So again, these measures are for critical access hospitals. It's not, looking at some of the, CMS inpatient or outpatient core measures, which seem to apply more to an acute care hospital or a much larger critical access. But these are specific to your critical access hospital setting. They can help you assess how well patient information is communicated from your ED, and it helps your ED provide patients with time-sensitive care that includes transfer to a tertiary care center effectively. It gives you the ability to assess, arrange, and transport the patient out the door with the necessary and appropriate information. Again, coming back to the stabilize and transfer notes that I touched on earlier. It can be a matter of life or death importance. You will be getting, this is just an example, technical support and quality improvement assistance from Wyoming Flex with the help of myself to provide you with data collection training, technical assistance, and support for interpretation of your reports, helping you with developing an action plan to address opportunities for improvement, and so on and so forth. And we can actually do benchmarking and have done some benchmarking with the Wyoming Critical Access Hospitals. So, I don't really know why I titled this recruitment message because the majority of the Wyoming Critical Access Hospitals are doing this. But again, if you're new to your position at your facility and are kind of wondering where your facility stands, please feel free to reach out to us and we can help you with that and give you the history on what your hospital has typically done. But just a few things, as to why this is important. Critical access hospitals are increasingly becoming more and more in the spotlight of federal policy, and it's more important now than ever to participate in efforts that help demonstrate the quality and value that you guys are providing to your rural residents in your communities. It helps improve transitions of care and a key component of increasing the quality, effectiveness, and efficiency of healthcare services you provide. Effective transfer of patient information from the ED to the next site of care can help foster continuity of patient care and help to reduce errors, improve outcomes, and increase patient and family satisfaction. And that has actually been proven. There was a little, case study done about how improving your ED transfer actually can make an impact on your HTAP scores. So again, this project allows you guys, UCAHs to evaluate and improve the effectiveness of the important role that you play as the safety net for your rural communities. So just a few things to touch on. As I mentioned when I was doing the tool demo, the reporting is done quarterly, and data is entered into that ED transfer Excel tool that I showed you, and then that report can be run and generated, and then that needs to be emailed to Kyle Cameron and myself. And then here on the screen I have some deadlines for you. So we just had the fourth quarter deadline, which was at the end of January, the end of last month, and then going forward, the next quarter due, which is first quarter, January through March, data, that's going to be due at the end of April. And then, of course, I gave you the next couple just as a FYI. And then, again, how we're going to help you is, again, we're here for technical assistance and help with the software and any other programs to submit quality data. We will help with reports. We have done some quality improvement activities. We're continuing to do quality improvement activities geared towards ED transfer measure improvement. And then we do have quite a few tools and other resources to help you if you want to take it more another step outside of the activities we've been planning and working on with you guys, as well as the reports that we've been helping with and the trends and so forth. Just feel free to reach out. We're happy to help in any way we can. And then here on this last screen, just real fast like, is my contact information, as well as Kyle Cameron's contact information with Wyoming Flax. And with that being said, that's the end of the presentation. And feel free to reach out to myself and or Kyle if you have any questions. Thank you.